Thanks, Cheryl, and thanks to Blue Buffalo and to the vet school for letting me be here with you today to be part of this really cool event. It's a privilege to work in a city where we have a top 5 children's hospital next to the James Cancer Center, Comprehensive Cancer Center, and a fully functional and really innovative veterinary school right here. It's this kind of unique amalgamation of real excellence and striving for excellence that brought me here to Columbus and that's kept me here until now. And I think we should take a minute to just appreciate kind of how unique that is and how cool that is. And we appreciate all of those who recognize the opportunities that are there, because I think there's still room to capitalize on the opportunities that we have with those partnerships. As a physician specializing in the treatment of children with cancer, and as a laboratory scientist looking for cures, I have appreciation in the value that working together can bring us. I've always appreciated my interactions with my veterinary colleagues. I have a lot of respect for them and for the work that they do. And that appreciation grows with time. I think, just to give an example, recently we made some kind of interesting discoveries in the lab, studying a bone cancer that spreads kind of relentlessly to the lungs in kids. Right? We've been asking ourselves, what is it that makes that tumor go to the lungs? And we had some kind of interesting discoveries. But when you have those discoveries, you have to kind of step back and ask yourself, is this real, right? Is this just something that's a function of my animals in the lab and my cell cultures, or is this something that's real? And we have to figure out a way that we can go to a real cancer to see if that works, right? And normally, when a pediatric oncologist would face this question, we would start thinking about building clinical trials in kids and ways that we could kind of ask those questions using drugs or using biology or getting samples or something like that. And I'm here to tell you that that is a painful and expensive and a very long process to do. And with a lot of times that's with good reason. But it hurts when it takes forever when you have kids actively suffering from these diseases to have such a long time to answer questions, right? And so we're fortunate to have such a good relationship with our veterinary colleagues here at the Veterinary Center. And so in this particular case, they see dogs all the time that have the same disease. I mean, it's the same disease. It's genetically the same disease. It's clinically the same disease. It responds to all the same medicines, right? And so why not use that as an opportunity to make things happen faster? And so taking advantage of those resources, we've been able to launch a clinical trial testing some of those ideas here at the vet school. And by my calculations, just back of the envelope, it seems that this study will happen about 4 times faster than it would in kids. It'll be about 10 times less expensive. I think we can do it in about 1/5 of the time that we could to accrue the number of patients that we'll need to make it happen. And we should be able to achieve endpoints about 5 times quicker in the dogs than we would be able to in the kids, which is awesome, right? Who wouldn't want to do that? They say, I think the dog years is the same in disease as it is in life too. Things always just seem to happen faster. And while this makes a lot of sense from a business standpoint, I think that that's not the real benefit, and that kind of misses the point, because the real benefit is that we can get treatments to kids who need them faster, right? And we can get treatments to our kids that are more likely to succeed, as Cheryl talked about, the great failure rates. We want to get kids drugs that are going to work. And so we appreciate this opportunity. And by the way, we hope that this also makes things better for the dogs. By participating in the trials, the dogs also get an opportunity to benefit from kind of the cutting edge, best ideas and best medicine that we have out there. And it's hard to think of a better win-win situation. So I, as a pediatric oncologist, want to thank Blue Buffalo for their support of the clinical trials office here, and for the support of our colleagues and the leaders at the OSU Vet Center. Many of us have seen the potential of working together with our or with our veterinary colleagues for years, but that collaboration has long been hampered by a lack of resources. As pediatric clinicians, it's the same as our veterinary clinicians in that our immediate attention needs to be on our patients, right? And we all know that good research is highly dependent, 100% dependent on good data. And it's hard to pair giving your patients full attention together with doing all of the meticulous tracking and recording and documenting that's required to do good clinical trials. We solved this problem in pediatric and human medicine a long time ago with the advent of clinical research associates and clinical trials offices and things like that in pediatric medicine. But our veterinary colleagues for a long time have been stuck trying to do all of that work themselves. And that's just really hard to do. That's just really, really hard to do. So when Blue Buffalo makes similar resources available to our veterinary colleagues that we are spoiled with a little bit in the pediatric world and in the human world, now we can get stuff done, right? And now we can work together, and now we can make these things happen. The collaborative work we've done would clearly not have happened without the support of the clinical trials office here. And I can't tell you how cool it is that Blue Buffalo has had the insight to recognize the value that such infrastructure brings to solving kids' cancer as well as to solving dog cancer. So we just launched our second trial with OSU Veterinary Clinical Trials Office, and we look forward to many more. So I want to say thank you to the vets, to the Clinical Trials Office and the staff there, to the College of Veterinary Medicine for their support, and to Blue Buffalo, but most of all, to the dog owners who have seen the value in making something good out of something really bad. Thank you for participating and for helping us make life better, both for the kids that will come later and for the dogs that will come later. It's cool to be here now. I'm looking forward to seeing how these collaborations grow over time. And let's cure cancer at both ends of the leash together.